A Baltimore City school nurse comes forward saying student safety is in jeopardy.
As Project Baltimore's Chris Papps explains, Baltimore City Schools has a shortage of nurses, and this nurse says it's North Avenue's fault.
When I was 16 years old, I got my EMT 3.
Glenn Carman has been a registered nurse for 42 years.
I've spent my life saving people's lives.
At 64 years old, he's not ready to retire.
It's not safe. The nurses are overwhelmed.
But in speaking with Project Baltimore, he realizes the decision to leave his job may be made for him.
Because I'm not scared of retaliation. Okay? What are you going to do to me when I'm telling you the truth? And to be very honest, if they fired me, I'm not sure that wouldn't be a blessing in disguise.
About 5 years ago, Carman took a job with the Baltimore City Health Department, which is one of 22 vendors that supplies nurses to Baltimore City schools. Nurses like Carman, who work in school buildings, and others who offer private duty services for students with medical needs, like Qwantay Spearman.
I mean, it's sad because he doesn't have friends. So he's always by himself. So when he goes to school, that's like an outlet for him.
Qwantay is a junior at Connections, a charter school in West Baltimore. He missed the first 140 days of school this year because city schools did not have a nurse for him, which is part of his federally mandated IEP, or Individualized Education Program.
I believe they don't care because this is where this services is supposed to be coming from.
This nurse tells Project Baltimore this is a bigger problem than one student. Carman says he has 4 students with IEPs just at his school who are supposed to have nurses, but don't. He says 2 of those students are able to attend school because he has stepped in, doing what their private duty nurse would.
I'm doing their tube feedings, okay? In addition to the regular duties that I have for all the students. I have a student who doesn't have a private duty nurse because he doesn't meet the needs, who had 5 seizures the other day. That's in one day. That's 5 seizures. That's 5 times I had to leave the nursing station to go and assess this child.
As of mid-April, Carman says there were 63 Baltimore City students he was aware of, like Qwantay, who did not have a nurse and could not attend school. Baltimore City Schools told us that number as of April 25th was 23 students. But when we asked for data for the entire year, North Avenue declined. Baltimore City Schools is experiencing a nursing shortage. The COVID pandemic drove many nurses out of the profession, causing a national shortage. But Carman says part of the problem is that city schools just didn't prepare.
Baltimore City, all right, did not do their work. They did not try to get nurses over the summer. And so when they decided in August to come looking for nurses, any available nurses had already been picked up.
According to the Baltimore City Health Department Union, there are only 24 full-time health department nurses dedicated to city schools. Another 30 or so come from other agencies. That adds up to just over 50 nurses to cover about 160 city schools.
They are jeopardizing those students, okay? And at this point, my hands are tied. I'm doing everything I can, and I can't meet the needs.
But Qwantay's needs, similar to other students with IEPs, are not optional. IEPs are mandated by the federal government and funded by taxpayers. In Baltimore City Schools, the money goes into the special education budget, which in 2022 was $207 million. Funding for private duty nurses is part of that.
The money should be reimbursed because they didn't provide the service, so why should they get the money?
Fox 45 News contacted other local school systems to see if they are facing a shortage of private duty nurses. Anne Arundel, Howard, and Carroll County schools said no. So we asked City Schools about Carman's allegation that North Avenue did not do enough recruiting to prepare. They declined an interview, saying in a statement, the City Health Department is responsible for recruiting school-based nurses. As far as private duty nurses, the statement says City Schools has worked with our vendors to help them attract more candidates, including by changing our contracts to enable the agencies to increase their pay scales for private duty nurses.
There needs to be something done, and just a slap on the wrist isn't an answer, because that's not going to stop them from doing it again or continuing to do it.
I'm Chris Pabst, and this is Project Baltimore.